Hi, I want to talk for a few minutes about heel spurs, mainly because I keep getting patients come into my office that have been told they have a heel spur and they think they need surgery for it. So before we talk about heel spurs, we have to spend a minute talking about the condition plantar fasciitis, which is the most common cause of heel pain in the foot. Now, the plantar fascia is this thick ligament that runs from here up to your toes. If your foot is flattening more than it should, as it flattens, it gets longer. And as it gets longer, if you look at these bottom pictures, that plantar fascia goes from quite loose to quite tight. So it tugs back here on the heel and causes pain in that region. Now, over many years, tugging on that plantar fascia can result in a heel spur. There's a law of physiology called Wolff's Law. It says if you tug on bone for a long enough period of time, you'll develop a spur here. So you have a lot of patients that have heel pain. They go somewhere, maybe an urgent care clinic, and get an x-ray, and it's seen that they have a heel spur. They're told that the heel spur causes the pain, but in fact, the spur doesn't cause any pain. The spur is just a reaction of the bone. What's causing the pain is the tight plantar fascia. So if you think that if you've been told you have a heel spur and you're told you need surgery for it, get a second, third, or even a fourth opinion. You probably do not need surgery. This problem rarely needs surgery. What we do need to do is to take tension off of the plantar fascia so it is not tugging so hard on this region. And there's some simple ways to do that. You want to wear good shoes. So if you just go to our website and do a search for shoes, you'll find our list of recommended shoes. We update it every year. There's athletic shoes and basketball shoes and hiking boots and sandals and dress shoes, any type of shoe you're looking for. Number two is we want to make sure we've got good arch support under the foot to stop that foot from going down. By doing so, you take tension off of the plantar fascia, and then it doesn't matter if you have a heel spur, you won't have pain down there. So this is a good over-the-counter support. If you just go to our website and do a search for home care or self-care of heel pain, you'll find our recommendation on the best over-the-counter arch supports for heel pain and plantar fasciitis. And you'll find some for athletic shoes, you'll find others that are made for dress shoes. And then if that's not enough, you see a podiatrist. There's a lot of ways to treat heel pain. And again, on the website, we go over that in great detail. I don't want to oversimplify this right now. But one of the things we may end up doing is making you a custom orthotic that grabs the arch tighter so it takes more tension off of the plantar fascia. And again, by stopping that tugging, in most cases, you can eliminate the pain in that region, or at least it plays a big role in helping people get over the problem. Again, I don't want to oversimplify that. There are a lot of different treatments for plantar fasciitis, but the big one I want to emphasize here is you probably do not need surgery even if you do have a heel spur. Heel spurs do not cause pain. All right, so that is it right now on heel spurs. Like I said, there's a lot more information on the website. Just search for heel pain. And if you like these videos, please subscribe.